All right, so the other thing we're going to talk about is a couple different pieces of equipment that we're going to find in our OTAC Primus kit or our IFAC kit. One is going to be this clotting sponge. This is a QuikClot sponge, so it's infused with a powder that's actually going to help stop our bleeding. The other one is going to be a wound stop. This is also known as an Isreali or Isreali dressing for military guys. You'll be really familiar with this. These are awesome. This is a nice compact kit that'll fit perfect in our IFAC. I carried several of these, different sizes of them, and they work great. The other nice thing about this is even though you take it out of the packaging, you can practice with it, you know, and it still may be useful if you know, an emergent care type related issue. But as you can see, as I pull it out of the packaging, we're going to have about a 4x8 bandage that's in there, and this is just going to continue to wrap open, and basically we're going to have our Curlex or elastic bandage and your bandaging all in one. And it also has where it clips on there. So basically we're going to take this, we're going to place it right on a wound, and once it's on that wound, we're just going to go ahead and wrap it around, whether it be in an arm or a leg, and you can be able to, you know, tighten it up as much as you want to help do some pressure on there for the bandage or for the wound. And then once you have it on there nice and tight, you just clip these two in and it'll hold it. And like I said, this is a great piece of equipment. Not only is it compact, but you're not having to carry, you know, extra 4x4s or 5x9s and an extra elastic bandage. It's all in one right here, and you saw how small that packaging was. So great piece of equipment. This is probably something I would use right off the get-go if I have somebody that has sustained some type of an injury or a wound that's bleeding. This will probably be one of my frontline things. I've used these several times. Great, they're excellent pieces of equipment. The other side that we're going to look at is this clotting sponge. Now, I wouldn't recommend this just for a normal cut. I would probably use this more in a case where we have a deep laceration that you know, that we cannot get to stopped. You probably would even be considering using your tourniquet in place of this, but it's still a great piece of equipment, and I'll probably even use our wound stop with it to wrap it with. Basically what it does is it accelerates the clotting factor in your blood. And I'm not 100% for sure what QuikClot uses as their main clotting ingredient, but it's probably a clay-based solution. That's what most of them are, is a clay-based material inside here. So basically what we're going to do is we're going to open this up, and I'm going to be really careful because there's going to be powders and stuff that open up in here. And once we get this open, here it is, and you can actually see, if you look inside there, this sponge has just got a bunch of clay like material in there, and that's basically, we put that right over the top of the wound. We'll push down nice and hard, and then we're going to secure it around with whether you're going to use your Isreali or wound stop, or just a normal piece of elastic bandage, or even maybe a 5x9 to cover over the top of that. And basically it's going to speed up the clotting factors in your body to help stop the bleeding. And you can see, if you look right here kind of closely, you can see some of these powders are coming out of this. So if you do use this, you know, make sure you mark in the time that you used it, and keep this packaging so when you get to the hospital they know exactly what we put on that person. So